I've had a lot of people come up to me recently on the NHS and ask me how I remove tonsils without a general anaesthetic under local anaesthetic. And that's strictly not true, but there is an element of truth to it. So I want to explain this in a little bit more detail so you know exactly what I'm talking about. The first thing is that I'm not really removing the tonsils at all. I'm shrinking them down to make more room for people to breathe through. So I'm not holding onto tonsils and using scissors to cut them out like you normally would with a general anesthetic. I'm using a Celon radiofrequency ablation. It's basically a probe. So you numb the area up. You sit in a chair a bit like that one there, and you put a needle into the tonsil at different areas, and you turn on the machine, and it provides energy to the tonsil, which doesn't burn it, or it sort of slightly cauterizes it. And the idea behind that is that you don't want it to slough off and just drop off. You want it to slightly change. So it's a bit like heating up egg white. It just starts going white. And you don't want it to start frying or any of those other things. You don't want a huge amounts of heat directed to that tissue. You only want a small amount. And the idea behind that is that, well, surely that would stay the same. It should be just tonsil, but then it's just gone a bit white. It is a little bit to that, but that energy transfer dehydrates the tonsils slightly. And so, we're all 68.9% water or something like that. What you're doing is by passing electricity through there, is that you are dehydrating the tonsils. So they do shrink almost immediately. They don't shrink away and disappear because, there's still tissue there. But the dehydration process itself gets rid of some of the water, and therefore it shrinks down a little bit. The reason why it shrinks down quite a lot later on, maybe 3 or 4 weeks later, is the process of damaging the tonsils ever so slightly makes the body start up a process of looking at that tissue and going, actually, this is non-viable tissue. It's not going to work anymore. Let's just scar it off. And I'll explain what that means. So if I made a scar just about here on my arm, and I maybe remove some tissue, some skin here, you'd have a big red area that will swell up initially, go red, and then it'll flatten out in a week or so. And then it'll just be this red area on the inside of your hand for some time. If you waited a few weeks, sometimes a month or so, particularly in the tonsil area, you'll get this white scar tissue forming there. That's scar tissue, fibrosis we call it. You create this sort of thing that contracts down like this. You get a contraction. Some people with burns, you see that their skin is all being not stretched, but contracted in. That's what we're hoping for. We're waiting for the scar tissue to take hold. And then although they've got maybe 30, 40% smaller initially, but from the dehydration, what you're really doing is then shrinking it down to almost sort of normal tonsil size for adults. So normal tonsil size for adults is grade 1. You can barely see them. They look like a bit of fibrous tissue on either side of your throat. If you have big tonsils and you want to decrease the size of the tonsils, not remove them altogether because they're still there, really. If you just want to decrease the size, if they're huge and blocking your airway, which is why I'm involved. I help people with snoring and sleep apnea. I'm a surgeon. I'll put my name down somewhere so you can see this. But reducing the size of the tonsils to allow people to breathe is really important for some of my patients. They may be not allowed to have an operation. They're scared of having an operation because they're overweight and they've got sleep apnea. They've got all these other problems. Maybe they're scared of bleeding or the pain after a tonsillectomy. These operations where you're just doing a shrinkage of the tonsils rather than removal altogether helps them because that means that they can start using CPAP better. Their only problem is the big tonsils blocking their airway, having 2 big meatballs in your throat. And so opening up the airway so they can breathe better means that they feel a lot better. CPAP, whatever works, or maybe they don't even need CPAP at all now. And all of a sudden, because there's not so much physiological pressure on their bodies, they find the weight is much easier to get rid of because I've done videos about this already. It's not sleep apnea being caused by weight gain. It's the other way around. Sleep apnea causes you to gain weight. And if you get rid of your sleep apnea, most people will lose all the excess weight they gained because they had obstructive sleep apnea. So anyway, you numb the area up, you put the probe in different parts of the tonsil, and then cauterize it so it shrinks down ever so slightly from the dehydration effect. And then you say, look, it's not going to be painless. It will hurt a little bit, but it will shrink down over the next, I don't know, sometimes 3 months, sometimes 3 weeks. Some people are different. And if you've got an infection, it takes a little bit longer. If you've got lots of infected tonsils, it takes longer. But if you don't have infections and it's just big tonsils, they generally shrink down quite quickly. Now, it's a little bit like ablation. It's a type of tonsil operation where you don't, again, remove the tonsils. What you're doing is you're sort of vaporizing layers off until you're left with a cuff of tissue behind. Now, there are pros and cons to coablation as well, and they sort of come together with the Celon radiofrequency. With coablation, because you're leaving a cuff of tissue behind, it's not so painful because there's tissue between, you've got tonsil tissue sitting there, and you're not gone right down to the muscle, the arteries, which may bleed, and the nerves that may hurt. So all these areas you're trying to avoid exposing. But when you remove the tonsils altogether, you're leaving this big, almost like an ulcer on each side of your throat, which is why it really hurts. And you have to wait for the skin to grow over that before you start feeling a bit more normal. With a coablation technique, what you're really doing is leaving a cuff of tissue behind. You're removing most of it, but you're leaving a cuff of tissue behind. So you're not going right on to the nerves and the blood vessels and the muscles and things like that. So that makes coablation, depending on how much you leave behind, it makes it less painful. So if you left 20% of your tonsils behind, the pain is not that bad at all. Most people, however, reduce it down to 5% or even 1%. Some people go right down and they use this technique to bring it almost like a tonsillectomy operation where you're cutting everything out altogether. Now, that's fine, but the pain scores are roughly the same. It may be a little bit less pain on the first day, but when you look at all the evidence, the pain scores are roughly the same. If you leave more than 5%, if you leave less than 5% of the tonsil behind, you get the same amount of pain and more bleeding than a normal operation where you cut it out, which is unusual. But that's what the National Prospective Audit did showed in this country. We looked at, I think, 40,000 tonsil operations. And coablation was one of the operations which caused more bleeding afterwards, which is a little bit worrying. But as I said, there are pros and cons to each of these things. With the radiofrequency ablation, this technique where you're sitting in the chair under local anesthetic, the more tonsil you leave behind, the lower the risk of bleeding, lower the risk of pain. But then the more you leave behind, the greater the risk of it growing back. So if you left 5% of the tonsil behind, you took out 95% of the tonsil, there's therefore a 1 in 20 chance, 5% is about 1 in 20, there's a 1 in 20 chance of it growing back and you needing the same operation again. If you leave 50% of the tonsil behind, you barely feel any pain at all, but then there's a 50% chance of it growing back. So there's a little bit of give and take. Do you want us to go really close and get rid of most of it with the lowest chance of it growing back, but you get higher pain scores and bleeding scores? Or should we leave as much as possible so, we may be just reducing it bit by bit for some time? And that's easier when you're doing it in a local anesthetic setting. You come in, shrink it down a little bit more, see if you can deal with it. So it's a careful discussion with your surgeon. You need to make sure you're doing the right thing for the situation that you're in. For example, if you get lots of infections and you want your tonsils out for that, well, then leaving a cuff of tissue behind or leaving any viable tissue behind, it seems like the wrong idea to do a coablation technique or a radiofrequency ablation technique. You need to remove your tonsils altogether because there's always a chance of what's left behind getting infected and growing back again and then causing the same problems you have already. So we need to figure out what's the best thing for you when you come and see your doctor. In my case, I'm a surgeon that deals with snoring and sleep apnea patients. Some people just want their tonsils reduced so they can breathe better behind it. And that makes complete sense. But, shrinking down tonsils generally isn't enough to solve all sleep apnea and, snoring problems. It does help an awful lot, particularly if you're a young, thin person with huge tonsils, grade 3, grade 4 tonsils, which are almost touching each other. A radiofrequency Celon ablation will reduce it roughly between grade 1 or grade 2. So it works really well, but you still have tonsil behind. And remember, most adult tonsils are grade 1, which they shrink down with size, with age, should I say. So children aged typically 5 to 7 have quite big tonsils, sort of grade 2, grade 3. And that's the biggest they'll ever be in your life. Once you've gone past puberty, the tonsils slowly reduce in size. And later on, they become little fibrous bits of tissue on either side, but you don't really need the tonsils after that, it seems. So the idea of this operation is to shrink it down so it's no longer blocking your breathing. Some people desperately need their tonsils taken out, but they've had a heart attack recently, and therefore they're not allowed to have an operation, a general anaesthetic. And therefore you might go, well, if you're desperate and you need it out now, we'll do it under local anaesthetic. That might be a good case to have your tonsils reduced in that situation to improve the sleep apnea. So the sleep apnea doesn't make your heart problems worse. So there are situations out there where this is the right thing to do, and often the only thing you can do. I hope that makes sense. What I didn't want is for people to think that I could somehow remove tonsils easily. And I remember when I was I think it was Serbia a long time ago, in my training days, and I went to a clinic where they would grab people's tonsils and just cut them out in clinic, and they would just sit there bleeding, and the doctor said, it'll stop eventually. And that's terrifying. We don't do that on the NHS. It doesn't really bleed when you cauterize something. It's almost the opposite of bleeding. It stops bleeding. It's not something that's done in this country. It may be done in other countries still, but I don't remember it being done anywhere else. What I'm doing is just cauterizing it, which shrinks it down. We're not removing the tonsils altogether. I just want people to be aware before they come and talk to me on the NHS about this, so that there's no sort of disappointment that I can suddenly remove this and it will solve all their tonsil problems. I want you to understand that all of these operations have pros and cons, and understanding this would really help. I've actually got a video which will come up somewhere here, I reckon, which will tell you all about the different types of operations out there. And I'll put some other videos here, and everywhere, which will explain it in more detail, different parts of tonsil operations. Anyway, or if you want my book, it's just about here, I guess. Anyway, take care. Bye-bye.